Okay, my name is LeeAnne Lubbock. Today I'll be talking about my informative speech. 3 million people in the United States alone have epilepsy according to the CDC. Epilepsy is a chronic seizure condition that many people suffer from. Epileptic seizures can last a few seconds up to a few minutes for one in itself, much less if multiple happen at a time, according to the Cleveland Clinic. I will be talking about the long-term effects epileptic people may suffer from. I personally have done a lot of research on this topic to be a reliable source, and I have also had first-hand experience as well due to my mother having epilepsy her entire adult life. So I have seen firsthand what effects there are in the long run for those who suffer from it. There are many reasons that this information is important. Firstly, being that someone you might know have the disease, and this might be able to help you understand it. And secondly, you can potentially help others understand the disease as well, especially since so many people suffer from it in the United States, much less the world. The 3 long-term effects we are going to focus on are the memory issues associated with epilepsy, the injuries you can receive from epilepsy, and finally, the employment and financial burden that many epileptic people face. And now we will talk about the most important effect according to my mother and as a child whose parents suffer from epilepsy. One of the long-term effects of having epilepsy is memory loss. This particular one is not only hard on the patient, but also those around them, similar to the way that when someone has Alzheimer's, it is hard on both the patient and the family. Memory loss due to epilepsy is pretty common due to the way that your brain works when you have a seizure. According to epilepsy.com, if seizures are triggered in the frontal lobe, it can potentially cause damage to the hippocampus, which is largely in control of memory. The hippocampus kind of acts like a librarian in a library. It's all still in your information, is in your brain still. However, if you do not have your hippocampus, you do not have something to guide you to it. So you might never find it, or if you do, it will take a lot longer. I personally have seen my mom have trouble with her memory. She is only in her late 30s, and she is already having issues and has been having seizures since she was 19 years old. There's also the fact, which I know from personal experience, that patients typically do not remember having their seizure. In my experience, my mother will in a way wake up after a seizure and not understand why she is on the floor. And when we try to explain, she doesn't understand. So she needs to lay down for a while, and finally, after she wakes up, we can explain what happened to her, and she understands that she had one, but she does not have any memory of it actually happening to her. This can also be dangerous due to the fact that if she is injured and no one is home, she doesn't know what to do until after she wakes up, if she does, which leads into my next topic. The long-term effect I want to bring up now is injury due to epilepsy. This is considered a long-term effect because many times injuries will affect you for your life, whether it is soreness or pain in a spot, or possibly something worse like death or long-term injuries like being crippled, being paralyzed, or other issues. When someone has an epileptic seizure, they are lucky if they can sense it coming. At least I know in my mom's experience, she can have a sense of it in the day. However, she has no way of knowing exactly when it will be. And so a seizure can start at any time, or it might not even start at all, even though they sense one coming, which typically can lead to some kind of injury or possibly even death since they have no idea of knowing when it will happen. My mother has had a seizure in the shower once when I was in elementary school. I remember hearing her fall and check on her only to see her seizing in the shower with the water still on. I still had no idea what to do at the time, and so I ended up going to find the home phone and calling my father. Eventually, my uncle and my aunt and my grandmother showed up. However, it was a while before they did, about half an hour. And in that time, on the phone with my dad, I had to check my mom's pulse for the first time, and I had to turn off the water and everything because I had to make sure she wouldn't drown, which was very scary as an 8-year-old girl. And then there is also another time that my mother, when no one was home, fell in the shower and smacked her head on the bathtub and her hip on the faucet, and she was passed out by the time my stepfather had come home. So he had ended up having to rush her to the hospital. She luckily lived, but it could have gone a different way. She could have been crippled if she had fallen on her spine, leading to her being paralyzed, or she could have even died due to injury if it had been worse, but luckily she only had a concussion. I personally didn't look up other examples because I already have them. My great aunt died from a seizure in the shower since no one was home, so I am personally aware of what can happen. There is also SUDEP, which stands for sudden unexplained death in epilepsy. Less than 1% of epileptic patients pass from this. However, it is still a risk according to the Healthline media. Injuries could also affect an epileptic person's ability to work, which leads into my next topic. Many people with epilepsy face long-term debt due to financial problems and employment issues. There are quite a few issues that epileptic people face when looking for jobs. The first being that most companies will not hire an epileptic person due to their seizures being a risk in the workplace. This is really common for companies to deny patients with epilepsy due to safety issues. There is also the issue that many epileptic people cannot have stable jobs due to the fact that in most states at least, you have to fulfill a requirement to have a license to drive if you have epilepsy. According to epilepsy.com, you also in Iowa need to have been seizure-free for at least 6 months to have your license, and a doctor needs to attest to it. And if you have a seizure or an accident, you will lose your license until you can go another 6 months without not having one. Due to the fact that most people with epilepsy cannot drive due to seizing, it makes it so many companies won't hire them due to not having reliable transport or vehicle. Not having a job then leads to a lack of income for the patient and potentially their family. This leads to a lot of financial issues, especially the fact that most people with epilepsy also have a lot of medical debt due to their condition, the medicines, the appointments, and the surgeries needed to keep up with it. According to the National Library of Medicine, the average annual cost with epilepsy ranges between $200 to $11,500 per year, and while some of that can be covered by insurance, many epileptic people find it hard to find insurance since not many companies insure health problems that existed before joining their plans. So in conclusion, epilepsy causes a lot of very detrimental long-term effects to those that suffer with it, and to their families as well. Memory loss due to seizures, injury due to seizures that can result in death potentially, or even financial issues due to medical debt and lack of income due to lack of employment are just the tip of the iceberg when it comes to the long-term effects of having epilepsy. People lose family members due to this, and many families suffer from not understanding their loved ones, and the effects of epilepsy have started. So it is important that more people talk about it so everyone can understand epilepsy in itself. Especially since according to the World Health Organization, over 65 million people have been reported to have epilepsy currently in the world. And then I have a slideshow to show before Lily shows my audience again. This is an EEG seizure comparison. That is a partial seizure, EEG, and that is a generalized seizure, which is what most epileptic patients face. And so it shows difference in the general of the seizures between the sizes. This shows where everything is. So when it is affected in a partial one, it's typically just your temporal lobe. However, when it is a generalized one, it is everything. Your cerebellum, temporal lobe, frontal lobe, occipital lobe, and the parietal lobe. And then this is the difference in normal and an epileptic brain. This is the normal one. As you can see, it's a lot more brightened up. However, in an epileptic brain, there's a lot more dark spots because your brain isn't as active. And then this is the map of epilepsy around the world. Lighter colors are where it's less likely. Darker colors are where it's more. In the United States, we have 3 million, but we're one of the lightest colors on this map. A lot of the darker colors you will find are in East India, South America, and Africa. And that is it for my presentation, and Lily will now show my audience. And she is an audience member in herself.